My name is Robert Masson. I'm a neurological surgeon from Orlando, Florida. I am also a micro-reconstructive spine surgeon, professional race car driver in the prototype class, and I'm a spinal cord injury patient with spine reconstruction. Before my injury, I was very avid as an athlete. I needed surgery ultimately because of training for one of my sports. I was doing a lot of competitive wakeboarding and had this flip routine that I would practice on trampoline. One of my kids came up behind me on the trampoline. I had to push myself away, but in doing so, I landed on my head. It was clear that I had a neck injury and took a while to validate that I needed surgery. To me, there was no option. Fortunately, I had all the right scenarios that made me a candidate for artificial disc replacement, so I chose prodisc. If you come into a surgical procedure like a prodisc, which really gives you immediate flexibility, movement, and purpose, as soon as your soft tissue worries are healed, you're back to who exactly you were pre-surgery. I was running like I was pre-op, I was training like I was, and over the next 6 months I continued to altitude train and hike and do everything I needed to do to successfully climb Kilimanjaro in February of 2014. It's not just the surgery to get you out of pain, it's surgery to get you back to who you want to be. So many people see these injuries as the end of their physical life. They see it as the end of who they want to be. There's a lot of amazing technology out there, a lot of incredibly committed and talented people out there capable of giving you a safe, successful intervention. With prodisc and the best support system, we can achieve complete recovery.